Activities of Daily Living Practice Test for the CNA. Which of the following is the most appropriate time to use a soft toothet? A. When a resident is complaining of a toothache. B. When giving an unconscious resident mouth care. C. When a resident has dentures. D. When a resident is having a seizure. The correct answer is B. When giving an unconscious resident mouth care. In this situation, a soft toothet, often soaked in a prescribed solution, can be used to gently cleanse the inside of the mouth and the oral tissues. Using a toothet helps prevent mouth dryness, reduces the risk of infection, and helps maintain the oral hygiene of unconscious individuals. A resident is recovering from a stroke and has weakness on their left side. They ask for assistance in putting on a sweater. Which of the following is the most effective way to assist the resident? A. Stand in front of the resident and help both arms simultaneously. B. Start by guiding the resident's right arm through the sleeve first. C. Stand behind the resident and help both arms simultaneously. D. Start by guiding the resident's left arm through the sleeve first. The correct answer is D. Start by guiding the resident's left arm through the sleeve first. When assisting a person with unilateral weakness or paralysis due to a stroke, it is generally best to assist by starting with the weaker side. In this case, that means starting with the left arm to ensure the resident doesn't have to stretch or struggle to get the weaker side into the sleeve. This approach is often more comfortable and less challenging for the patient. Which of the following would be an inappropriate action when providing hygienic care to a resident? A. Apply lotion to the body with extra coverage between the fingers and toes. B. Thoroughly dry skin to prevent breakdown after washing. C. Examine the skin for any areas of skin breakdown or injuries. D. Encourage the resident to participate in their hygienic care. The correct answer is A. Apply lotion to the body with extra coverage between the fingers and toes. Applying lotion to the body may be indicated, however, it should be avoided, in excess, between the fingers and toes. Lotion may serve as a medium for bacterial growth, which can lead to infections and skin breakdown. Residents should be encouraged to participate in their self-care to the extent of their abilities. Skin should be dried thoroughly and examined to identify any potential risks or current breaks in its integrity. It is time to bathe an Alzheimer's patient who has had visitors in the room for most of the shift. Which of the following is the most appropriate action for the nursing assistant to take? A. Ask the charge nurse to speak with the visitors. B. Perform the bath as your first task the next day. C. Ask the patient when you should come back. D. Ask the visitors to step out until the bath is complete. The correct answer is D. Ask the visitors to step out until the bath is complete. It is crucial, and within the scope of duties, for a nursing assistant to take charge of a patient's privacy. It is also important to see that ADLs are accomplished within a reasonable time span, and the question indicates that visitors have been present most of the shift, giving no opportunity for ADLs to be completed. Visitors can wait in another area. A patient with Alzheimer's may not make the best decision as to when their bath should occur. The nursing assistant is helping a quadriplegic resident eat dinner. Which of the following actions by the nursing assistant is inappropriate? A. Sit at eye level with the resident. B. Offer the resident small bites and allow time for chewing. C. Encourage personable conversation with the resident. D. Offer the resident drinks only after all the meal has been consumed. The correct answer is D. Offer the resident drinks only after all the meal has been consumed. Drinks should be offered throughout the meal, every few bites. This allows the resident to have access to fluids to help wash down the food previously eaten. A resident is often late to physical therapy because she is very slow at feeding herself during breakfast. What is the best action for the nursing assistant to take? A. Bring the resident to breakfast earlier. B. Encourage her to eat faster by taking her plate away when it's time for her physical therapy. C. Begin feeding the resident breakfast. D. Withhold breakfast until after physical therapy. The correct answer is A. Bring the resident to breakfast earlier. Bringing the resident to breakfast earlier allows the resident to continue independently feeding herself and still make her physical therapy on time. The other options either encourage dependence or could border on neglect. Which of these is an incorrect procedure for shaving a resident? A. Shave upward on the neck. B. Before shaving a resident, check on her records and with the nurse to be sure the resident does not have a bleeding problem. C. Use a towel around the resident's chest when shaving his face. D. When shaving the face, start from the chin and shave upward toward the sideburns. The correct answer is D. When shaving the face, start from the chin and shave upward toward the sideburns. Remember, the question asks for the incorrect procedure. Shaving the face from the chin upward to the sideburns is an incorrect technique for shaving a resident. You need to start at the sideburns and shave downward. All of the other options are correct procedures when shaving a resident. Which of these is not a common mealtime and eating challenge that residents often face? A. Decreased recognition of hunger or thirst. B. Loss of ability to manipulate eating utensils. C. Not being reminded when it is time to eat. D. Chewing or swallowing problems. The correct answer is C. Not being reminded when it is time to eat. If a care facility is doing its job, residents will be reminded of when it is time to eat, will feed the resident using caregivers or have nourishment given intravenously. This is the only option that should not be a problem for proper care of residents. The other answers are frequent and common challenges residents face. Which of these is an important fact that is easily overlooked or forgotten by caregivers and facilities in reference to resident bathing needs? A. The water needs to be at a safe temperature for bathing. B. Beliefs about bathing frequency differs among cultures. C. The caregiver needs to use proper body mechanics to avoid injury when bathing a resident. D. The resident should be rinsed and dried thoroughly. The correct answer is B. Beliefs about bathing frequency differs among cultures. Cultural differences in the frequency and types of bathing should be taken into consideration, although it is not often thought of when setting a resident's care schedule. All of the other answers are part of standard operating procedures for bathing. Which of these may depend on facility rules when performing nail care on a resident? A. When providing nail care, report blue or pale nail beds to the nurse. B. Nails are easier to trim if the feet or hands soak for 10 minutes before starting. C. The policy on cutting toenails. D. Nail care is best provided if the resident can sit in a chair, although it can be done with the resident in bed. The correct answer is C. The policy on cutting toenails. Many care-giving facilities only allow nurses and physicians to cut a resident's toenails. The other options are all within the scope of a nursing assistant's role for nail care given to residents. Which of these statements is false for the care of a resident's dentures? A. Dentures should be stored in cool water. B. Dentures break easily and are expensive to replace. C. Denture care is left to the resident, so a care facility cannot be charged with negligence if something goes wrong. D. Dentures are very slippery when wet. The correct answer is C. Denture care is left to the resident, so a care facility cannot be charged with negligence if something goes wrong. This statement is not true because many of the residents are incapable of taking care of their dentures properly. All of the other options need to be taken into consideration for the proper care of dentures. All of these are proper precautions for residents who are unable to move by themselves, except A. The resident should be routinely checked for pressure sores. B. The resident should be turned once on every nursing assistant shift. C. The resident should be turned every 2 hours. D. The resident should be left clean and dry from incontinence. The correct answer is B. The resident should be turned once on every nursing assistant shift. Turning a resident once for every nursing assistant shift is not often enough to prevent circulation-related problems. All of the other options are critical when handling a resident that cannot move themselves. A Hoyer lift is primarily used for A. Helping to move a resident onto a stretcher. B. Helping to move a resident into a bathtub. C. Helping to move a resident to a chair. D. Helping to move a resident into a vehicle. The correct answer is C. Helping to move a resident to a chair. A Hoyer lift is a safety device that is used to help move an immobile resident from a bed to a chair and back. The other options are not the primary purpose of the Hoyer lift. Morning care, sometimes referred to AM care, before the resident eats breakfast is important for which of these reasons? A. It adds to a resident's sense of well-being. B. It helps to decrease harmful bacteria. C. It provides a pleasant appearance. D. All of these are correct. The correct answer is D. All of these are correct. All of these reasons are correct. Morning care, also known as AM care, before a resident eats breakfast is important for several reasons. It helps to decrease harmful bacteria. Performing oral care, such as brushing teeth and cleaning dentures, before breakfast helps to remove bacteria and plaque that may have accumulated overnight. This promotes good oral hygiene and decreases the risk of oral health issues and infections. It provides a pleasant appearance. Morning care involves grooming activities like washing the face, combing hair, and ensuring overall cleanliness. This helps residents to look and feel refreshed, enhancing their personal appearance and promoting a positive self-image. It adds to a resident's sense of well-being. Engaging in morning care routines contributes to a resident's overall well-being. It promotes feelings of cleanliness, comfort, and confidence, which can positively impact their mood and mental state. Starting the day with a sense of cleanliness and care can set a positive tone for the rest of the day. Key considerations for bathing residents include safety, privacy, and which of these? A. Quiet surroundings. B. Swiftness in procedure. C. Providing security. D. Dim lighting. The correct answer is C. Providing security. When a resident is undressed and in a vulnerable state, the most important consideration beyond safety and privacy is providing security. Bathing and showering are common activities that produce anxiety. While the resident may want the procedure rushed, too much swiftness could cause injury. The surroundings vary from resident to resident and some may prefer quiet, while others are soothed by conversation or music. Dim lighting is another personal preference, but safety must be the utmost concern. Bad breath, tooth decay, and skin breakdown in the mouth are all symptoms of A. Inadequate amounts of toothpaste used when brushing the teeth. B. Dry mucous membrane in the mouth. C. Overly moist mouth. D. Dehydration. The correct answer is B. Dry mucous membrane in the mouth. Dry mucous membrane in the mouth can lead to various symptoms, including bad breath, tooth decay, and skin breakdown in the mouth. When the mucous membranes in the mouth become dry, it can result in reduced saliva production. Saliva plays a crucial role in maintaining oral health by lubricating the mouth, washing away food particles, neutralizing acids, and preventing bacterial overgrowth. When there is inadequate saliva, the mouth becomes an environment that is more conducive to the growth of bacteria, which can lead to bad breath and an increased risk of tooth decay. Additionally, the lack of saliva can contribute to skin breakdown and irritation in the mouth, causing discomfort and potential oral health issues. Dehydration, inadequate toothpaste usage, and an overly moist mouth are not directly related to the symptoms mentioned. Dehydration can contribute to dryness in the mouth, but it is not the only cause. Inadequate toothpaste usage would not directly cause dry mucous membranes. An overly moist mouth, on the other hand, is not typically associated with the symptoms mentioned. An important, but frequently forgotten, consideration when providing hair care to residents is A. Length of stay. B. Environmental conditions. C. Race and culture. D. Age. The correct answer is C. Race and culture. Race and culture are often overlooked when discussing hair care with residents. Listen and be conscientious of how others' culture or race may differ from your own opinions on hair care. While age, environmental conditions, and length of stay can all play a role in the resident's appearance and hair, they are not major contributors. A small, watery leakage of stool could indicate which of these conditions? A. A fecal impaction. B. Pelvic muscle weakness. C. A GI infection. D. A medication reaction. The correct answer is A. A fecal impaction. A fecal impaction occurs when a hard feces is trapped in the large intestine and/or rectum and cannot be pushed out by the resident. It should be suspected when only a small amount of watery stool is leaked onto the clothing or after the resident has reported defecation. It is a condition that requires immediate reporting to the licensed nurse, as further intervention is necessary to prevent complications. Behaviors that may signal pain in the elderly may include all of these except A. Not eating or drinking. B. Not participating in social activities. C. Excessive talking. D. Insomnia. The correct answer is C. Excessive talking. The elderly may have an increased pain tolerance. It doesn't affect their activities or rest, or the inability to perceive pain. They may deny pain but demonstrate behaviors that indicate discomfort, such as insomnia, decreased appetite, or withdrawal from recreational or social activities. Physical signs of pain include tachycardia, increased pulse, tachypnea, increased respirations, dyspnea, difficulty breathing, and hypertension, high blood pressure. Which of these is not a way to assist a resident to rest more comfortably and effectively? A. Offer diversion activities such as reading, listening to music, and meditation. B. Create a quiet environment. C. Pacing their ADLs, recreational activities, and visiting times to allow for proper rest. D. Remove all positioning devices so they don't interfere with sleep. The correct answer is D. Remove all positioning devices so they don't interfere with sleep. Positioning devices should be used to promote comfort and rest when needed. The pacing of activities is important so that the resident does not become overtired and anxious, which can prevent relaxation. The provision of quiet, calming activities and a calm environment are also important in inducing rest. In addition to these answer choices, you may provide a massage to help relax the resident, or you may give emotional support during times of discomfort. These options would be in addition to generally maintaining the individual's routine and physical environment to promote safety and security, which encourage rest and sleep.